It's hard to find a person whose life isn't affected by cancer, but almost all of us will have a family member, a loved one, or a friend who is. And none of us are immune.
I had been out of breath sometimes while training for a triathlon, and I just assumed I wasn't in very good shape. And so when I went in, I thought it was silly that I was getting these tests, and I just thought we need to be done with this and I'll find out it's nothing. So I was quite shocked that it turned out to be cancer.
Our story begins when Matt was 7. He had a routine screening exam. The surgeon said that the tumor was inoperable. So we ended up at Children's Hospital in Seattle, where the standard treatment at that time was 66 weeks of chemotherapy. We went over weekly for that, leaving home early in the morning so we could get in line for the Bainbridge ferry at 6:30 in the morning. And hopefully, if we got lucky, if all the stars aligned just right, we'd catch the 3 o'clock boat home. But usually it was like 4:30 boat, and so we'd get home about 13 hours after our trek had begun on that day.
When I came here in 1980, my vision for this community was that we would develop an oncology program that would provide state-of-the-art treatments to people in their hometowns so that they could be with their families, with their friends, to try to continue to work, to contribute to society. And even if they couldn't, we could make their lives easier by providing something close to their home.
I felt really lucky that I was able to receive care over here because I wanted to spend time with my kids. I wanted to, see my husband and my family and my friends. Having the cancer care over here meant that I drove for 10 to 15 minutes to receive chemotherapy, or I would drive maybe 10, 15 minutes along Tracyton Boulevard and get to go have radiation and be home within the hour.
Someone in the process mentioned that we could come to have chemotherapy at home if we could find someone that would administer it. I called Dr. Ronald Reimer, and he took us on, and he was like our knight in shining armor because we didn't have to do that trek anymore. Instead of Matt going on Tuesdays and being sick for the rest of the week and missing school, we went Thursdays after school. And so he was able to go to school all day and eat a normal meal that day and then go and have his chemotherapy. And they were so accommodating to us and always made us feel so comfortable. And I could bring my daughter along. My husband would stop and pick her up and take her home. I was just so thankful that we were able to do that here at home because it totally changed the whole experience.
The people that do best are the people that have their family with them, and their extended family and their friends. And it's kind of rare that we have people come to the office by themselves. We usually have at least one and sometimes a whole room full of people that come.
The amount of psychological support, the physical support, getting someone to and from a treatment when you're tired, helping with meal preparation at home, just helping run errands. Family members are everything to the success, I think, of someone getting through treatment.
I've had several patients over the years that were the sole breadwinner in the family. For them to be treated, let's say in Seattle or Tacoma even, would oftentimes mean them being away from their job, being away from the source of income for the family, being in a situation where they could even lose their health insurance when they needed it the most. By treating people in their own community, oftentimes they don't have to miss work. They can still be there functioning to take care of their families. And I think that that's a very, very integral part of this. Do it at home. Do it a little bit better, a little more personal, a little more warmth, and a lot more humanity. And it'll be a better experience for everybody.
I am so grateful for the care that I received at Harrison. That includes the doctors, it includes the nurses, it includes anybody that I came into contact with. Because you're scared, you're worried, you're tired, you're feeling ill, and yet no matter what, you have all these people who are answering your questions, who are bringing you whatever you need, whether it's medication, a pillow, something to eat, and doing it in a way that didn't make me feel guilty or bad that I was in need of help, but instead were so compassionate in helping me all the way through.
We never know when it's going to be us. Did I ever dream that my 7-year-old was going to end up having to have the medical treatment that he's had and go through chemotherapy for as long as he did, and actually go through it twice? If you'd have told me that when he was having his 7th birthday, I'd have said, you're nuts. 7-year-olds don't get dread, awful brain tumors. If it does happen, it happens to those kids that are on the television set that you don't ever really have to look at eye to eye or tuck into bed at night. And so, because you never know when it's going to be you, when it's going to be your family member, when it's going to be your neighbor, when it's going to be that best friend, it's got to be here where they can get what they need in the right way, close to home, so that it's the least painful experience.